After completing mastoid canaliculi, from where auricular branch of vagus will pass, now anteriorly, focus anteriorly in jugular foramen, anterior wall. See here, this beautiful, you are able to appreciate this small canaliculi. This is known as tympanic canaliculi in the anterior wall of the jugular foramen, and exactly in front of anterior wall, this is the carotid canal through which internal carotid artery will pass. So in between carotid canal and anterior wall, these are the tympanic canaliculi. And what will be transmitted through it? Tympanic plexus, tympanic branches will pass through it. So tympanic branches of the relating to the middle ear cavity. These are the branches which will pass through it. Also caroticotympanic nerves will transmit. And tympanic branch of glossopharyngeal nerve. There is second structure, tympanic canaliculus. Now medially, if we just medial to, if this is the carotid canal, then medial to this carotid canal, here if we focus small foramina here, and on this side, let us focus on this side, this is the carotid canal, yes, these are the small foramina. So medially, these are known as the cochlear canaliculi, cochlear canaliculi. Through these cochlear canaliculi, there will be passing of the aqueduct of cochlea. So through this aqueduct of cochlea, the perilymph will be communicating to the CSF through subarachnoid space. This is a 1 mark question answer, or it is asked in MCQ. Aqueduct of cochlea will pass through cochlear canaliculus, and through aqueduct of cochlea there will be communication between perilymph in the ear along with CSF present in the subarachnoid space. So this is the cochlear canaliculi. Where is it located? In the anterior wall and medial to the carotid canal. Anterior wall of the jugular foramen, but medial to carotid canal. So 3 canaliculi. All the 3 canaliculi can be asked in viva, but major portion it is asked in 1 mark question answer or MCQs. Laterally mastoid canaliculus, anteriorly tympanic canaliculus, and more anteriorly and medially cochlear canaliculus. Now exact location of cochlear canaliculus will be apex. There will be apex of this small depression. Here this small depression which we are able to see will be for the presence of the ganglion of glossopharyngeal nerve. So at this apex of this depression, at the apex of this depression there will be cochlear canaliculi. So here we finish all the 3 canaliculi surrounding the jugular foramen. Now we come to one important segment, and that important segment will be 3 transverse lines which are called datum lines, D-A-T-U-M. Now these 3 transverse lines are the structures, the foramens, the various segments of the skull which are lying across transverse lines. Supposing this probe here, if this will serve as transverse line, then what are the structures which are related to these 3 transverse lines? Therefore, these 3 transverse lines at the base of the skull are known as datum lines, D-A-T-U-M, and we divide into posterior, intermediate and anterior. First, the posterior. The posterior transverse line will pass across. Now, what is the measurement or what is the landmark where this line will pass? For example, norma lateralis, this is external acoustic meatus. Posterior wall of external acoustic meatus. If we consider to draw a line, posterior wall of external acoustic meatus. Across this posterior wall of external acoustic meatus, what are the structures which are passing across this line? The structures will be number 1. See this structure. The number 1 structure will be stylomastoid foramen. Number 2 structure, the posterior wall of jugular foramen. Like this. Yes. And number 3 structure, the hypoglossal canal. So once again, the posterior transverse line passing across posterior wall of external acoustic meatus. What are the structures lying across it? Number 1, stylomastoid foramen. Number 2, jugular foramen. Number 3, hypoglossal canal. And number 4, there will be, according to the books, it is mentioned that these occipital condyles, the anterior 1/3 and posterior 2/3 of occipital condyles, this transverse line has to pass through anterior 1/3 and posterior 2/3 of occipital condyles. But here if we pass this transverse line, it is passing anterior to these occipital condyles. But basically, as mentioned in books, Please remember this transverse line posteriorly will pass between anterior 1/3 and posterior 2/3 of occipital condyles. So 4 structures will pass through the posterior transverse line. And what are those structures? What are those structures lying across this posterior transverse line? Number 1, from lateral to medial, stylomastid foramen. Number 2, posterior wall of the jugular foramen. Number 3, hypoglossal canal. And number 4, anterior 1/3 and posterior 2/3 of occipital condyle. This is often asked in MCQs also. Middle transverse line. Now, once again, middle transverse line will pass from, this is mandibular fossa. So, posterior wall of mandibular fossa, from here, we pass our middle transverse line. So, what are the structures lying across the middle transverse line? Structure number 1, petrotympanic and petrosquamous fissure. Petrotympanic and petrosquamous fissure. This will be structure number 1. Petrotympanic, this exactly this point. Petrotympanic and petrosquamous fissure, which I have discussed with you in previous segments. Then structure number 2, there will be, remember this, spine of sphenoid. So important, so beautiful structure, spine of sphenoid, structure number 2. Structure number 3, if you recollect, what is this passage? Junction between the greater wing of sphenoid and petrous portion of temporal bone, and this is called sulcus tubi. And in the morning, greater wing of sphenoid is developed from the Ellis sphenoid. So this is sulcus tubi. What will be present in this sulcus tubi? Here there will be the auditory tube. So junction between bony and cartilaginous part of auditory tube, that is structure number 3. Once again, I'll recollect, the middle transverse line will pass across the posterior wall of the mandibular fossa. Structure number 1 lying across this middle transverse line, structure number 1 which is lying across this middle transverse line will be petrotympanic and petrosquamous fissure. Structure number 2 lying across this middle transverse line will be spine of sphenoid, and structure number 3 will be the junction between bony and cartilaginous part of auditory tube. And structure number 4 will be, now if I keep on passing this line, see here, structure number 4 will be exactly this point. And this point is pharyngeal tubercle. This is pharyngeal tubercle lying at the base of basi-occiput, at the base of the basal portion of sphenoid and basi-occiput. This is pharyngeal tubercle. So 4 structures which are present across middle transverse line. And we pass to the anterior transverse line. See here, this anterior transverse line will pass like this. We start our anterior transverse line from this tubercle. If you recollect, this one will be known as articular tubercle. So from the articular tubercle, that is the anterior wall of mandibular fossa, this line will pass through foramen oval. You can see this is foramen oval. It is passing through foramen oval. The structures lying across the anterior transverse line will be foramen oval. Then this foramen lacerum. So foramen lacerum. And what includes in this foramen lacerum? In the anterior wall of foramen lacerum, there will be opening of pterygoid canal. So that pterygoid canal which is present in the anterior wall of foramen lacerum is also included in it. That is structure number 2. And structure number 3. See here, it is passing exactly at this point. And this point is nothing but junction between basi-occiput and basi-sphenoid. So it is passing through the junction between basi-occiput and basi-sphenoid. Once again, what are the structures which are lying across the anterior transverse line? The structures which are lying across the anterior transverse line are 3 structures. Number 1, foramen oval. Number 2, foramen lacerum. In the anterior wall of foramen lacerum, there is pterygoid canal. And structure number 3 will be junction between basi-occiput and basi-sphenoid. Here we finish the 3 datum lines. So here we finish our Norma Basalis extema. And then in the next segment, tomorrow we are going to start with this cut portion where we are able to see inside. This entire interior portion is Norma Basalis intima, in which we are going to discuss anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Thank you very much.